The proceeding will start shortly.
Order, order, and hello and welcome to the International Development Committee's evidence session on humanitarian crises monitoring on the impact of COVID-19. Today we will focus on the impact of COVID-19 on global health and the UK's work with Gabby following ICAI's latest information note. And as chair of the subcommittee, Sarah Champion has kindly called me to chair this evidence session due to its link with ICAI's work. Could we start with the witnesses briefly introducing themselves? If I could turn first to Tamsin Barton.
Thank you. My name's Tamsin Barton and I'm the Chief Commissioner for the Independent Commission for Aid Impact.
Thank you. Professor Watts.
Good afternoon, my name's Charlotte Watts and I'm the Chief Scientific Advisor at DFID.
Daniel Greymore.
Good afternoon, my name is Danny Greymore. I'm the head of DFID's Global Funds Department and also DFID's Senior Representative based in Geneva.
Thank you. And Amanda Glassman.
I'm the Chief Executive Officer of the Center for Global Development in Europe and a Senior Fellow there.
Thank you very much. So to start off, I'd like to hand over for the very first question to my colleague, Pauline Latham. Pauline, I think you need to unmute yourself.
Sorry. Yes, I wonder if I could ask Tamsin, before we go on to Gabby, what her view is on the announcement today of merging or getting rid of DFID and going into the Foreign Office, and how that's going to impact on ICAI, because they were set up, I understand, to report to this committee. If this committee doesn't exist, what does she believe will happen?
Thank you for that question. So I should say, first of all, that of course it's been a matter for government to decide on the machinery of government change, and it's a matter for Parliament to decide how committee scrutiny will be done. At the time when I last gave evidence in relation to the inquiry on ODA effectiveness, then I did draw attention to the question of how scrutiny would work, whether if there were to be a merger, then the committee would, as normal in Parliament, have a counterpart department. So we hear there's a new department to be established in the autumn of Foreign and Commonwealth and Development Office, I believe is the name. So there will perhaps be a committee set up exactly as a counterpart to that department. In the past, when there were separate ministries, then there was a subcommittee looking at overseas aid. So I would say from our perspective that we would hope to feed into whatever scrutiny there might be, and it will be a matter for Parliament whether it's a subcommittee of this departmental committee or whether, like other committees such as Women and Equalities, there would be a cross-cutting committee. But what we would say is very important at times like these, obviously the tight fiscal resources, economic challenge, it's more important than ever that there is scrutiny to ensure value for money for the taxpayer.
Yeah, thanks very much. I completely agree. We must continue to scrutinise the 0.7%. And I personally don't see how that will happen if it's just Foreign Office with a bit of DFID. Anyway, if I could carry on with you, Tamsin, how could you summarise ICAI's overall findings in the information note on the UK's work with Gabby?
Thank you for that. So I think I should say first that it was we were very pleased to be able to respond to the chair's interest in ICAI providing some evidence to help you as a committee in your scrutiny of this replenishment. And normally, of course, we always have our robust criteria for deciding which topics to select, and we think that Gabby scores very highly on our key criteria: financial materiality. I mean, the UK has already invested £4 billion in Gabby up to now, and this is a further 1.65 billion committed for 2021 to 25. It's also of enormous strategic importance. And I think that has been seen from what it has already delivered at the heart of the global health system in vaccinating 760 million children. And so that indicates the direct, on the ground, life-saving impact that it can have. But I think more remarkable about Gavi is that it's been an innovative partnership, which has developed innovative instruments. And what you've seen is, as a result of that systemic and transformational change for even more children, because the cost of vaccines has been lowered by more than half in some cases. And of course, its role has come more to into the public eye in the context of a global pandemic, which on the one hand is disrupting its important routine work. But on the other, if you didn't have a multilateral setup like Gavi able to use global cooperation to deal with this health threat, then it would be much more difficult to respond. And if you didn't have the innovative instruments that have been pioneered under Gavi, it would be hard to see how a vaccine could raise front-loaded resources to respond. And indeed, our note does highlight that there appears to be a gap, however you look at it, despite the great success in the UK's hosting of the replenishment, which did succeed in getting more pledges than planned. Nevertheless, estimates of the development and deployment of a new vaccine have ranged up to 20 billion. So and at the moment, this replenishment was just based on Gavi's original plans pre-COVID, where they were hoping to raise 7.4 billion. So it's hard to see with the 2 billion that they hope to have just for the most minimal vaccine deployment, they'll be able to close that gap. And I think our note helps to raise some of the questions that there will be whenever there's competition for restricted resources. So there are major questions about Gavi's mandate, whether it can continue to focus on its routine immunization, which delivers very high value compared to the risk that there is of excess COVID deaths. And also whether it can, as the UK has been trying to push it to do, actually reach the hardest to reach, because without reaching the hardest to reach, not only are neglecting and leaving people behind, but you're also creating reservoirs of disease. So there are many questions that our note raises. I should say, by way of closing, that this hasn't been a full-scale ICI review. So we haven't been able to do the in-depth review that you would get for a standard year of work. We've only looked at this over a couple of months and picked up the key debates that there are for you to consider. Nevertheless, we did previously do a review of the UK's preparedness for global health threats, and we were able to draw on that in our work.
Thank you very much. I wonder if I could ask the other three if they could just briefly comment on their views on ICI's information aid on the government's work with Gavi.
The other three, would you like me to come in?
Yes, that's fine.
Okay. I mean, just to say, and speaking on behalf of DFID, and I'm sure my colleague will also want to come in from DFID, is just as Tamsin just said about how important Gavi is to us, both in terms of the life-saving work it does around delivering childhood immunizations that literally saves millions of children's lives, but also increasingly in terms of its work to support global health security. So, for example, around delivering cholera vaccines, Ebola vaccines in Eastern DRC, and now really stepping up to use its expertise, its relationship with pharma to support the world as we look forward to think about how do we deliver a future COVID vaccine to developing countries.
Thanks.
I would just say ICI did note the importance of this new goal that Gabby has, which is on sustainable coverage with equity. But when you look at the measures that they will be using to assess this goal, it's things like doses of vaccine or number of kids vaccinated. So I think it's quite important to keep our eye on the ball of herd immunity, which is what delivers the public health benefits and the global health security benefits that Dr. Watts has pointed out. Because, you know, when we look at a country like Ethiopia, which has had 15 years of Gabby support, the pneumococcal conjugate vaccine that was introduced in 2011, the third dose of that vaccine for kids 12 to 23 months was only 50%. So we have a ways to go to ensure that herd immunity coverage.
And Daniel?
Thank you. So, first I could say, actually, we really welcome the work of ICI and doing the information note on Gabby. As my colleague, Professor Watts, has said, Gabby is critically important for the UK government and our international engagement more broadly, but obviously on our delivering on our priorities on global health in particular. Gabby has demonstrated enormous impact and innovation over the years, as others have set out, and we may come back to some of the results, but as was mentioned at the beginning of the session, vaccinating 760 million children, saving 13 million lives, but also working with private sector, with civil society, with governments and others to develop really innovative outcomes. And when you look at the ways in which vaccines that previously were either unaffordable or unavailable or the wrong sort of formulation, how they've been brought to become available and affordable in poorer countries. Vaccines like the pneumococcal conjugate vaccine, bringing in pentavalent vaccines, there's been enormous success. But I think most people here know that. I would agree entirely with Amanda that actually, of course, there is nonetheless a long way to go. And it's critically important that we continue to focus on the fifth child. Clearly achieving herd immunity is at the heart of a successful immunization program, but we must make sure we double our efforts to reach those children and those communities and those families who are left behind for reasons that others have said, partly because of public health, but also because of equity. And if we're really going to deliver on our ambitions and our vision to leave no one behind, it has to be done in a way that works with some of the poorest communities worldwide. But we also, and again, ICI were very helpful in identifying this, and it's an area that we are very aware of, is ensuring that we are very alive to the impact of COVID on Gabby's operations. We've seen both in routine immunisation and in campaigns significant disruption that is going to set back our mission potentially quite significantly. And one of the great opportunities we have in having secured significantly more than the 7.4 billion minimum ask that was set out for the Global Vaccine Summit 2020 is that we have additional resources, but we have additional resources to deploy against an incredibly challenging context, so partly in terms of reaching those communities and those children left behind, but partly in terms of reaching those communities when routine services, essential health services, primary healthcare services have been disrupted by COVID, and partly in ensuring that we can really deliver on some of the health system strengthening ambition that we all have. It's worth noting that Gabby's resource mobilisation drive over the last year was always very clear that it was seeking at least $7.4 billion. The Gabby Secretary at the Alliance, which of course is the World Health Organization, UNICEF, the World Bank, the Bill and Melinda Gates Foundation, and others working collaboratively, we're always very clear that one of the great opportunities, if we could secure additional resources, was to focus on health system strengthening. And as a final point on that side, as we look, of course, in the context of COVID again, and understand ever more the importance of pandemic preparedness and response, we need resilient health systems that meet the needs of poorer people and communities in the countries in which we work, partly for its own ends, but partly also because that creates a stronger global system, stronger global health security. And that's one of the key roles that Gabby plays, including through its emergency response work, as Professor Watts noted, on cholera, on yellow fever, and perhaps most obviously its work on Ebola, where Gabby was critical in bringing forward an Ebola vaccine, which has been deployed highly successfully in Eastern DRC, and is now being deployed again with the latest Ebola outbreak. So a combination of those public-private partnership ways of working, critically focused on the needs of the countries, primarily in the communities in those countries, has really delivered a great deal, and we have a platform now that can really help us at this particular time.
Thank you.
And can I just ask witnesses to keep their answers a bit shorter, because I know there's a lot of members who want to ask questions. So back to you, Pauline.
The only thing I was just going to say at the end, does anybody want to add anything about how these findings are relevant to the government's response to the COVID-19 vaccine? You don't have to, but if you want to, there's an opportunity.
So I think one key point that Tamsin raised is the sizing of the advanced market commitment for the purchase of the COVID-19 vaccine for low-income countries. So far, I think they've received about $579 million US dollars in contribution, and it's well below what would be required to purchase even at the $2.50 per dose amount that was named by AstraZeneca, and it's just not clear that that's the vaccine that will get over the line. I think the other worry that I have is whether that existing facilities that are used to produce existing vaccines may be repurposed, and that might affect the supply of Gabby's regular vaccines that they would buy on behalf of low-income countries. And so that's something we just have to watch as we go into this period, because that could further constrain our supply situation. And maybe a final issue is that because we're in an unprecedented economic recession, the likelihood that some of the countries that are already transitioned or were carrying more of a share of their vaccine budgets themselves, those countries may fall back into low-income country status, and that would require more funding for Gabby according to its existing eligibility criteria. And I'm not certain that that has been reflected in the amounts that were asked for the replenishment, although, of course, it's hugely good news that they received more than they asked for. So hopefully that will cover it, but it's worth watching.
Thanks.
If I can just come in quickly, I think Amanda's raising really important points. Just to say, in terms of our perspective on Gabby, we are committed both to supporting the core vaccination and also looking at, how do we ready for COVID vaccine delivery. We're very clear that along with the preventing the impact of COVID, we really need to ensure that we're trying to prevent those secondary impacts that you're saying are a risk. We need to be saving lives from the vaccine preventable diseases of today, as well as saying how do we look forward in terms of thinking about future vaccine delivery. And in our own analysis, we're very carefully, very much from our chief economist's office, trying to think about and look ahead and go, well, what might be the implications, for example, of the economic shocks and what that might mean about eligibility criteria, those sorts of things.
Can I just
add something?
Go ahead, Tamsin.
Very briefly, that what hasn't been covered, and I agree with what's been picked up by Amanda, I think the real risk is that the urgent might triumph over the important. And a couple of ways this could happen is Gabby's management time and the pressure it's receiving from donors and the challenges with the response to the new situation is likely to take them away, given the limited resources, from the really important questions that have been mentioned, for example, by Danny about health systems strengthening and mentioned by Amanda about equity. It's really, really hard to reach the kids that haven't been reached. So it's going to be much harder with this level of pressure, this level of economic damage to the countries themselves and to the donors. So there's a real storm heading in Gabby's direction in many ways, despite its importance at the moment.
Daniel, but keep it brief because I want to get on to the next question.
Certainly. Just 3 quick points. And partly on the Gabby Advanced Market Commitment that was launched at the Global Vaccine Summit on Thursday, the 4th of June. I would totally agree that the amount of money that was secured was both very, very positive against an initial ask of $2 billion. We secured about $560 million, and the UK committed to $60 million of that commitment. A number of other countries and institutions came behind that too, which we hugely welcome. But of course, when we look at the global need to ensure access and availability for any future COVID vaccine, it's going to need significantly increased financing. And it's also critically important that the advanced market commitment, which is fundamentally a pull mechanism, which is going to aggregate the demand of Gabby countries to enable them to actually purchase a vaccine, that has to be met, of course, by the work that CEPI and the Gates Foundation and the World Health Organization under the ACT Accelerator are doing on the that's the pull mechanism, the work they're doing on the push mechanism to invest in development of vaccines, manufacturing capacity, scale up, etc. So there's a large global effort that's making, I think, quite significant progress quite rapidly, of which the Gabby Advanced Market Commitment is a really critically important part. The second point I just wanted to say is on the COVID response. So Gabby, of course, in their own programming, are looking very carefully at how they can flex and reprogram to support countries in their response to COVID, including around things like enabling more flexibility on financing to buy personal protective equipment, or to invest in infection prevention and control, for instance, two of the largest areas that countries are using Gabby support to invest in at the moment as part of their immediate response to COVID. But also, of course, to look at how they maintain these essential routine immunisation and indeed campaigns work. And we know that, for instance, nearly 100 mass campaigns and outbreak responses have been affected by COVID, and about 68 Gabby-supported vaccine introductions have been impacted by COVID too. So there, indeed, as everyone is saying, maintaining that focus on keeping those essential services running. And the last point, just very briefly, I would say, is we've been, as the UK government, very clear for a long time that what we really want to see at the country level is enhanced collaboration between institutions like Gabby, the Global Fund to fight AIDS, TB in malaria, UNICEF, the World Bank, WHO, and others. And this is a prime example where actually coming behind countries' COVID-19 national action plans as required by the World Health Organization under the strategic preparedness plans that they've got, coming behind those as part of the UN country team is really important so that Gabby and the Global Fund and others play their part in maintaining essential services and also helping countries respond directly to the threats of COVID. And we're seeing some good progress on that side of things, but of course it's relatively early days.
Great, thank you. I'm going to turn to the next question to Sarah Champion. Oh, Sarah, I'm still on mute.
Thank you, Chair. I and the committee are still reeling from the merger that's going ahead and has been announced today. So that's going to influence my questions. Can I first turn to Amanda, who's probably the most independent of our witnesses? And could you tell me the announcements today, what do you think are likely to be the impact on Gabby? And as the sort of the 5-year strategy for Gabby, what do you think they ought to be putting in place to make them more robust in line with these changes?
So thank you for the question. I hope that this is one of those kinds of aid activities that will remain core no matter what organizational framework is in place. Obviously, it's hard to tell whether the emphasis on value for money and poverty alleviation are retained as part of the merger. So that's something we'll be watching closely. We certainly hope that it will. And that's a very important function of public scrutiny and oversight for value for money is also vitally important. The UK, particularly in the case of Gabby, plays an enormous role in its governance, in driving its direction and in assuring that it's accountable and delivering on the benefits that it set out. So I hope that the merger will not affect any of that very substantially. I hope that the new focus on global health security as part of aid would play to make Gabby just at the center of all of this. It's the most basic element of global health preparedness to assure that you have high levels of immunization coverage, herd immunity for the existing vaccines that are out there. And of course, to deploy COVID-19, that's the only way we deal with the economic consequences of COVID and sort of get back to something that looks like normal. Thanks.
Tamsin, if I could ask you, ICAI scrutinises all ODA spend, and it's finding that some departments are more transparent and more targeted in alleviating poverty than others. So in relation to Gabby and its focus on vaccines, do you think that the merger today has any implications in terms of transparency of how that money, which is a considerable amount of money that the UK is leading on, is being spent?
Well, I'd certainly hope that there would be no backtracking on the transparency commitment. So 2020 was, of course, the year in which all departments were committed to achieving the same levels of transparency as DFID, which is judged one of the best. So it's true that FCO is one of the departments which was less transparent, but in a merger, the hope would always be that the best systems are the ones which are preserved rather than the less good ones. So I mean, there's no necessary reason to expect that there would be any less transparency. On the question about whether there could be any diversion from the focus on poverty reduction, you know, some of the commentary about the merger has associated it with more focus on short-term national interests. I don't think that's what we've actually heard from the government. And when the announcement was made on the vaccine, then it was very much framed as a win-win, benefits to the UK, short-term insofar as you know, the risk of COVID-19 and other global health threats, this being a very good instrument to protect the UK, as well as having global benefit. But one of the possible lines of inquiry that we picked out in our note was if that framing might also contain any trade-offs as well as win-wins. And there, I think the sorts of things we had in mind were, might it be less focused on poverty reduction if there was more focus on threats to the rich world, if you like? Might there be potentially more focus on donor industries? Obviously, there's been a lot of discussion about UK role in the vaccine development. Might there be, as I've mentioned, because partly the urgent relating to the short term, might there be a loss of focus on those long-term agendas? Health system strengthening is a long business. You can't just switch around policies quickly in relation to that. And similarly, it's proved very difficult and challenging to achieve coverage, reach the hardest to reach, and so on. So if those were lost in a focus on the short term, that is where risks could lie in relation to Gabby. But as I say, I would hope that the best of DFID's evidence-based approach and focus on ultimate poverty reduction and sustainable development would not be lost in any merger.
And a question to Danny. Danny, you're head of global funds at DFID, as well as the UK Gabby board member. So I wonder, are you nervous about the long-term, the 5-year and onwards commitment of this government towards vaccines and Gabby?
Thank you. So I'm not. The UK has supported Gabby, of course, since its inception. It hosted the 2011 replenishment. It was very active in 2015 when Germany hosted the next replenishment. And of course, just on the 4th of June, we hosted the Global Vaccine Summit 2020. And we had an amazing outcome. As we noted already, we secured $8.8 billion against that $7.4 billion ask. There's many other great results. I think what that shows is the level of commitment from the UK government as a whole. We were able to work very closely as DFID with our colleagues in the Foreign Office, in Number 10 Cabinet Office, the Department for Health, AIDS and other departments to really mobilise the UK government's commitment to immunisation, global immunisation, and to Gabby, and bring together very senior global leaders to recommit to Gabby's future and the work in the 2021 to 2025 strategy. And I think that really demonstrates that across the whole of government, an instrument like Gabby and Alliance, key partners, is enormously valued, and we're very much behind it. And this money we just committed, it was announced in April by DFID Secretary of State, is for the 2021-2025 period, during which time these issues we've talked about already, reaching the very poorest, equity, gender, these are really important priorities for the UK. Emergency response, global health security, these are really important priorities. Utilising the private sector to create innovation and better prices and better access for poorer countries to critical vaccines. These are things that I think are firmly part of the UK government's engagement on global immunisation. And I reinforce, actually, if you look at our commitments just last year to the Global Fund to Fight AIDS, TB and Malaria, or our long-term work with the World Health Organization and other partners, the UK has very strong strengths in academia, in industry, as well as, of course, in government on global health and civil society, in Parliament. Huge commitment. And I'm confident that that will be sustained into the future.
Thank you very much, Danny. Can I bring in Dr. Charlotte? But Dr. Charlotte, I know that you're both the DFID's Chief Scientific Advisor and also a CEPI board member, but also your background is in preventing gender violence. So I wonder if you could tie all of those together.
Okay, I'll do my best.
Throw in vaccine and throw in Gabby.
Yeah, I mean, okay, I mean, I just make just a quick comment to follow up from Danny as well, because I mean, if you just look at the achievement of the replenishment, it was phenomenal. You know, this is a time when many countries are feeling the pinch, right? And yet they exceeded the target. And to me, that is the opportunity of bringing, and that was the result of both DFID's expertise and work, but also working very closely with Foreign Office and across government. And so I think that's the opportunity of the new department is that actually how do you mobilize and deploy that diplomatic influence alongside that commitment to development. And I think, you know, that we've got a department that has development in it. You know, it is foreign Commonwealth and development is a really important aspect to really sort of be more assured by. And Gabby basically shows that replenishment of what you can achieve when you can produce and use all of those levers in a really joined up and effective way. I mean, in terms of bringing in violence, I mean, I think the thing for me, I mean, if we're thinking about the response to COVID, if we're thinking about global health more broadly, you know, Gabby is critically important, but it's part of our response to global health pressures. We need also be to tackling the social, the economic, the gender-based inequalities as well, that also leads to poor health. And so, for example, if you look at our response to COVID, we're investing heavily in vaccines, diagnostics and treatment, but we're also supporting programs to work with more vulnerable groups of society to really give flexibility to our programs working on violence against women, recognizing that it's likely that there'll be increased risk as a result of both lockdown activities that are playing out around the world, but also as a result of the economic stresses and how that might play out. And I think that's one of the great powers of the ways in which we think about development, that clearly technologies can be game changers, but also we fundamentally try and support and bring evidence to also tackling some of those very knotty and complicated programs, complicated issues, which ultimately, if we're going to not leave anyone behind, if we're going to achieve equity, we really have to pay attention to as well.
And do you think you can not leave anybody behind when trade deals are shiny and dangling in front of the Prime Minister?
I mean, I think we're, you know, I think we get into sort of speculation of how kind of negotiations. What I do know, just to pick up on the gender issue on violence, is the extent to which across government and including very strongly in FCO, there is a really, you know, keen interest on tackling issues of gender equality, both sexual and gender-based violence, but also factors, for example, such as girls' education. It's in the government's manifesto, and I'm expecting that to, you know, continue to be receive significant attention.
Thank you, Chair.
Thank you very much. For the next question, if I could turn to Kate Ossamore.
Thank you, Chair. I'm going to move on to ask a few questions on the impact of COVID-19 on other immunisation programmes. And this is to Dr. Charlotte and to Danny. What is the department's assessment of the impact of COVID-19 on other existing global health threats? Whoever wants to go first.
Shall I kick off just on the global health threats and then maybe pass to Danny on immunisation? I mean, I think, and thanks for an excellent question, an important question, because, I mean, we are very concerned not only about how COVID might play out across the developing world, and we are really starting to see across a number of countries infections rise. And we aren't yet at the sort of level where we'll really start to see deaths potentially hit. But alongside that, we're very concerned about the secondary impacts, and those are multiple. So there are things like impact on immunization levels, but there's also other risks. So for example, if people perceive that hospitals are a place of risk, you might catch COVID there, that could impact on, for example, whether women actually go to health facilities to deliver babies or to access antenatal services. So that the breadth of impacts from COVID are multiple, and we think potentially in some settings bigger than COVID itself. So very much in the approach that we've taken in terms of our programming, we very much tried to both invest in the COVID response, but also to try and support flexibility and adaptation to try and ensure that you can continue the delivery of those other services. So for example, in our sexual and reproductive health services, they are both trying to ensure continued access to family planning across a number of countries, but also supporting those programs to also engage in COVID prevention, because it's really that combination that not only helps tackle COVID, but also makes people feel safer about accessing other services, which is probably going to be most effective.
Thank you.
Danny, do you want to come in?
Danny, did you want to come in? No. Oh, you did. Okay.
I'm struggling to unmute myself, which is possibly the worst context I've ever struggled to unmute myself. Apologies. So just following up from Charlotte's response, I mean, as she says, I mean, clearly we can see COVID is a huge threat and challenge in the countries in which Gabby operates and in which we operate more broadly, and many of our global health initiatives. I mean, just a few kind of facts and figures. You know, actually 70 Gabby eligible countries now have reported 820,000 confirmed cases and 20,000 deaths, and we're seeing a fairly rapid increase of 4% per day in the numbers of cases in those countries. So you can see that although it's been a kind of relatively slow spread so far, it's going to follow a curve. It's going to be hugely challenging. And as we've noted before, we've seen in Gabby countries quite a significant number of campaigns and introductions being impacted, disrupted, delayed, and that's going to have a huge impact into the future. There's going to be children who have not been vaccinated for measles, who haven't received pentavalent, and are going to be more vulnerable and going to have ill health and all the problems that we look at. We've also seen, as Charlotte said, a loss of confidence in coming to be vaccinated. So even where introductions and campaigns have been sustained, we have situations where people just aren't coming to the clinic and not getting their children immunised. We've seen that. We've got quite a lot of evidence and data on the impact that's having. So there's going to be also an issue that we'll have to then deal with in rebuilding confidence, and the committee will be very aware of the risk of vaccine hesitancy or anti-vax kind of movements who can impact confidence anyway. So a situation like this is going to take longer to then remobilise community commitment and support. As I noted earlier, so Gabby has, and the UK was very active in working on the Gabby board to secure this. We encourage Gabby, Secretariat, we work with other donors to encourage them to come behind this. We encourage Gabby to introduce additional flexibility. I mentioned earlier the investment in personal protective equipment, infection prevention, and control. And so countries basically have the opportunity now to reprogram up to 10% of their health systems grants to support their direct response. At the same time, one of the things we'll be talking at the Gabby board next week will be how do you ensure that alongside that you're supporting continued essential services and routine immunisation, as I mentioned before. I will just, if it's okay, just to repeat the point I made earlier, which is that actually we've also seen significant...
Daniel, sorry, could I just ask you to keep your answers short, because I know a lot of members are still asking to ask questions. If you could just wrap up.
My last point, just that the Global Fund and the Global Polio Eradication Initiative are doing much the same flexing of their programming. So if you look at the global efforts and the response alongside WHO, bilateral donors like the UK, you can see that these instruments that the UK is such a firm supporter of are really there at the front line, both doing the direct response to COVID, but also maintaining essential services to avoid the impact of disruption that we're so concerned about. Sorry about that. Thank you.
Thank you. Kate, do you have any other questions, or shall I hand over to Brendan?
I've just got one more question. Thank you for your answers, Danny and Dr. Charlotte. And this is to Tamsin and to Amanda. What should the government be doing to mitigate those threats and avoid undoing decades of global health progress?
Well, I'm sure Amanda will have a lot to say, so I'll try and be very brief on what government should be doing. I just thought it would be pertinent to go back to the review that we did of global health threats. And I've just been struck by listening to the pleas from DFID's side that other people should coordinate. I thought I should probably mention although we overall gave a positive rating and amber green to the work on global health threats, and you can see how important it is now, because otherwise WHO would have had no resources for its pandemic preparedness, etc. But one area where we were very critical was in relation to coordination across the UK government. And in fact, in that context, we had suggested that they work together on simulations if global health threats should arise. And the reason that we were wanting this to be across as many departments as possible is because you can never tell with different threats which parts of government are going to need to be part of the response. And of course, there are so many variabilities to the type of threat it might be. So I think it's back to my urgent versus important. Everyone thought there are more urgent things to deal with, but the government's investments in the long term at that time have turned out to be very important. And of course, it wasn't done perfectly, and so the shortcomings are more evident in the current situation. And so similarly, they should not lose the focus on health systems strengthening and on having a strategy, which is something that we often recommend at ICAI, but so we can come back to that question. A global health security strategy.
Yeah, I think one really important element of Gabby is that it is a partnership, and one of the members of the partnership is the World Bank. And we've already talked about how government revenues in low middle income countries are just dropping precipitously. And Gabby, Global Fund, GPEI, what they finance are the materials. They'll fund a vaccine mostly, or they'll fund bed nets, but it's governments that pay the salaries of workers. And actually, we just posted something that looked at, community health workers that are really the backbone of delivery. Only 26% of those are remunerated right now. So we're in a situation where public expenditures are falling very dramatically in countries. So we really do have to pay attention to what the World Bank is doing to support countries. In particular, we want just budget support, really, because we want to be able to sustain salaries and things like that. But perhaps we could say, we'd like to see you protect spending on vaccination. We'd like to see you increase vaccination coverage during this time, or at least sustain it. So there's the kinds of things that we might think of in the context of Gabby Alliance, but also in the context of the UK government as a key donor and governor of the World Bank as well. On health system strengthening, that is where the bilateral UK support to governments is so important. Part of the merger announcement that did worry me was the comment that juxtaposed assistance to Ukraine with assistance to Zambia. And, it's just Zambia has a $4,000 per capita GDP compared to about $10,000 in the Ukraine. It's just a different kind of resource constraint. So it would be a pity to lose that focus on low-income countries that are going to be hit the hardest by this COVID-19 contraction and have very little, no fault of their own trying to cope with these fiscal consequences. So I do hope that we'll watch too what happens with bilateral aid and the focus on low-income countries during this period. Thanks.
Thank you. If I could turn now to Brendan Clark-Smith.
Thank you, Joe, and good afternoon, everybody. Just first question to Dr. Barton, please, if I could. What key lessons from previous global health threats does the government need to learn and apply to the COVID-19 pandemic at the moment?
Well, of course, the previous global health threats, which were most in view at the time when ICAI did its review in 2018, were the Ebola epidemic. And that, fortunately, has so far been confined to a relatively limited geographical area. But as we observed in our review, you can never tell what the next global health threat might be. and it was in that context that we strongly recommended having a global health security strategy, and specifically recommended cross-government simulations so that you'd actually go through in real time. And these are exercises that government has experience of doing in other contexts, what each government would need to do, who they would need to contact, because there's global coordination, but actually there's quite complex coordination across different parts of the government. And that came much to the fore in a situation where the immediate threat to the health of people in the UK was more in focus. Although we should not lose sight of the fact that there is the potential for Ebola or other diseases to do the same. So I think that our shortest maxims on this would be very much to look to the long term, and credit to them for what they did do more than other donors in strengthening WHO and other global institutions. But it's very important to invest in resilience and not only look to shorter term investments. So I think those would be the main things. And having a strategy helps work out exactly what are the priorities so that you can focus on those and build them up, and that the relevant departments and actors can know clearly what their role is and what they're expected to do.
Okay, thank you. And Chair, if I can ask the other members of the panel, do you agree with ICAI's view? And what are the key lessons from previous epidemics for the government response to the current situation? Professor Watts, do you want to start with that?
I'll kick off. I mean, yeah, and thank you. I mean, I think Tamsin's point about coordination and joined up government working is really critical and very important. And just to say, for this outbreak, but also, just most recently thinking about the DRC, Eastern DRC outbreak, the systems across government have been really very joined up. So regular meetings that involves everybody, and particularly close working between ourselves, FCO, and Department of Health, but also bringing in other departments as well. So I think even though we haven't done the simulation, there were lessons learned about ways of working that and now that kick in very quickly as soon as a threat emerges. And I mean, I've just come from cross-Whitehall discussions, for example, on the latest Ebola outbreak. That's involving a range of stakeholders right from the beginning, because we know for any disease outbreak, early action is critical, and bringing all of our different lenses to what's happening and thinking forward, but particularly saying let's try and ensure that what we can do, act early is really critical. I think what we learned from the West Africa outbreak that served us well for East African Ebola outbreak, and is now being used very heavily also, is thinking about what are the systems and flexibilities and programs that you need in place that can pivot and can act quickly. So for example, in the research and development space, we've supported WHO to develop the WHO blueprint. And that essentially in peacetime, when there's no disease outbreak, is looking at across the range of threats, is mapping out what are the priority research areas, is using resources to move that forward, and then is able to move very quickly to start testing, be it a diagnostic, be it vaccines, be it therapeutics. And that has been part of the current response by WHO that's been very helpful, is that they've already got that roadmap, they've already got the relationship put in place, and are really now coordinating and influencing and triaging the types of technologies that need to be tested quickly, be that on a diagnostic, be that about our treatments. And that was one of the ways that we managed to get, for example, the Ebola vaccine, the Merck vaccine, deployed very quickly at large scale in the Eastern DRC outbreak, was that we'd set those systems in place and also could tap into clearly the capability of Gabby alongside that.
I'm just conscious of time, as I know we've only got 10 minutes left for this meeting. So Brenda, do you have any other quick questions, or I'm going to turn to our colleague Virendra?
Just very quickly to Dr. Bolton again, then, if I can, please. Has DFID acted on previous global health recommendations from ICAI, and in what areas do you think there's still room for improvement?
Well, I was interested to hear Dr. Watts's reference to the fact that they haven't had the simulations, because we had some trouble getting the evidence on this when we did our follow-up review. So that appears that's something that they haven't managed to do. And we've also not seen this global health security strategy. And we're also waiting for something very relevant, which we followed up in the context of another review on maternal health, which is the health systems strategy. Now, you might think, what's the point of all those bits of paper? But as I mentioned, they actually represent working out beforehand all the priorities for what needs to be done in a situation where you're under pressure, and making it clear whose roles are what. So in those areas, we feel that they didn't manage to follow up. But I think I've given credit to them in the areas where they did. So I'll stop there, given shortage of time. I can see what's to come back.
Yeah, I just wanted sort of a factual correction in that, you know, in terms of the global health security, there is a cross Whitehall senior level meeting, and there are very clear ambitions linked to that. So I don't want to misrepresent actually the extent of planning and activity that is happening on global health security.
If I may come in briefly, sorry, I think I was frozen before. I'm not sure if you can hear me now.
Then could you keep your responses very brief, because I do need to go to the next question. We've got about 6 minutes left.
Certainly. So firstly, I was going to reinforce Charlotte's point, which is the Global Health Oversight Group is the critical cross-Whitehall group that discusses health threats and the global health security agenda and our broader work on global health. It may be on a slightly kind of more micro scale is worth noting for the committee that I mentioned I'm the senior representative here in Geneva, so I run a department in DFID. I work very closely with our Department of Health and Social Care colleagues. I work very closely with the Foreign Office here, with our permanent representative, Julian Braithwaite, and others. It's just an example of the ways in which actually there's a very strong cross-Whitehall collaborative way of working. And a good example, I think, of that is actually the 6-year strategy that was signed off a couple of years ago for the World Health Organization, which is a way that we combine our different departments working together. The second point, very briefly, was on the lessons from Ebola, and I just wanted to reinforce the lesson that drawing down the strengths of Gabby, because that use of a vaccine in the Eastern DRC Ebola outbreak, of course, has been a game changer. And it's a game changer because we've invested in Gabby, because we've invested in the Health Emergencies Programme at the World Health Organization, because we've invested in a set of key partners and created those public-private partnerships, and the incentives to help the private sector actually invest in an Ebola vaccine. So that was really a real game changer. The other lesson that's been really important from previous global health security challenges, again on Ebola, and deployed in Eastern DRC, is how we need a whole UN response. We need to make sure that the really strong work of the World Health Organization is complemented by other UN partners who help on the community engagement and the security side. And that's really critically important. My last point is, one of the big changes from Eastern DRC, from West Africa and Ebola, was actually the recommendations to create a strengthened health emergencies program, including the contingencies fund for emergencies, which enables the World Health Organization to respond within 24 hours to alerts of health emergency outbreaks. And that's proven successful. It needs additional financing. It needs long-term government commitment. But as an instrument that's been very helpful has been the integrated approach of the health emergencies program. There are always lessons, there are always ways you can strengthen these things, but actually the UK has been instrumental in investing in those systems, and we've seen the impact in the last few years on the response.
Great, thank you. And next, if I could turn to Virendra Sharma. Virendra, you're still on mute. If you could unmute yourself. Thank you.
My apologies. My question is to Tamsin and Amanda. How achievable are Gabby's goals for phase 5.0, particularly given the current coronavirus pandemic?
Thanks very much. I'll be very brief. I know Amanda can furnish a lot more detail. I think that much of their goals, many of their objectives were achievable before the pandemic hit. The ones that were hardest related to equity, reaching the children so far unreached, and in relation to health system strengthening and sustainability. So all I would say is that they're much more challenging now because I'm not confident that they will retain the resources. You've already seen, as mentioned, that some countries have had to substitute for their normal health use of Gabby resources for health system strengthening to buying short-term emergency PPE equipment, which, as we know, soaks up huge amounts of money. And so if the pandemic were to take off, then that would have an enormous impact in, I suspect, shifting the focus and resources. So that's my worry about how realistic they are.
Yeah, I agree with that assessment. I think the two goals that are most at risk are the one about transitioning a further 10 countries to self-financing. It might be just the opposite, that we might not only have to retain those pre-transition countries in their eligibility status, but also take into account that a number of countries may actually fall back. And then the other piece is around the sustaining of the provision of vaccines. And we need to figure it out shortly. I mean, as Danny and others have pointed out, we have measles outbreaks in about half of the countries that suspended measles vaccination efforts. So this is not going to last a short period of time in low-income countries. Hopefully there's a vaccine, but it will take at least a year to get to low and middle-income countries, and therefore we have to think about reoperationalizing the system. That might mean a humanitarian response to get vaccination out.
Thank you. My next question is to Daniel. As the UK Gabby board member, do you agree with ICAI's and CGD's assessments? How can the UK use its position as a key donor to lead Gabby's response to these challenges?
Thank you, and I'll be brief. There's a huge amount that we would agree with. We've spoken already about what Gabby has achieved and how it's driven up global immunisation rates to really much higher levels than we had in the last period, up to about 81% global coverage, which is very impressive. But we are in an unprecedented period, especially with COVID-19. As others have said, that does represent challenges to the model. One thing that we're really keen to do next week at the Gabby board, as you say, I'm the Gabby board member, is to talk about what COVID means for new strategy. What needs to be different? What assumptions have we made that might need to be reassessed? And so we'll look very carefully at that. We think that the transition model is a really important part of Gabby, actually. It's part of its success, because what we want to do is have a model that helps countries to invest in their primary healthcare and their routine immunisation, and of course to take on increasing investment from domestic resources and be in a position to move out of Gabby support in time. But we fully recognise, of course, it has to be done in a way that really builds systems and is sustainable and can last into the future. And this current situation on the health side and increasingly obviously on the socioeconomic side represents a huge shock. So we will definitely be taking that sort of risk and that challenge on transition to the board discussion. And we will also be looking, as we said earlier, very carefully at this issue of equity and gender. How do we make sure that what we don't lose as we try to address the disruption and interruption of campaigns and routine immunisation, what we don't lose is a focus on leaving no one behind. But we have to redouble efforts. We have to look how we work with other global health partners. We have to look at how we use our instruments, how we build those systems. And fundamentally, for all of us, our objectives, stronger, resilient health systems that meet the needs of communities across the whole country is the long-term vision of what we want to achieve. And Gabby has to be part of that, and we'll fully support that.
Thank you. Very briefly, Charlotte, on DFID's perspective, do you agree with ICAI's and the CGD's assessments? And what is the UK's role in shaping Gabby's response to these challenges?
Thank you. I mean, I agree in that the challenges are huge. I mean, the impact of COVID is, just, vastly significant. And I think the UK's contribution is not only financial, it's also that technical. It's being on the board. It is creating that space across donors and with Gabby leadership to really say, well, what does this mean and how do we respond to this? And I think one of the things that, coming into government from academia that I'm hugely impressed by and what I see is the UK's commitment to creating the space to have those honest conversations, and allowing and trying to work with the leadership of Gabby and other donors to say, actually, how do we figure a way forward on this, so we don't come in necessarily with a predefined agenda. It's really trying to problem solve and support Gabby to really respond and rise to that challenge. And I'll be looking forward to seeing what the conclusions are from the Gabby board next week.
Thank you.
Thank you, Virendra. I had one question, which was, what difference will the Gabby COVAX advanced market commitment make to the global coalition for the development of a COVID-19 vaccine? Who wants to answer that first? Tamsin?
Well, I suspect that there'll be others who will be more expert on the detail. I mean, I'll just make two very brief points. One, that if we didn't have the model of the advanced market commitment before, then it wouldn't be possible to look at such a quick scaling up through Gabby and SETI. Although on the other side, as has been mentioned before, against the target of 2 billion, I think I get my pounds and dollars mixed up, but was it $567 million only committed, which the UK committed, I think, 48 million pounds. So, you know, there's a long way to go in terms of resources there, but potential and hugely important UK role in establishing the model of the advanced market commitment. And indeed, innovative financial instruments more generally.
Dr. Watts?
I mean, just to reiterate what Tamsin said, you know, it's been demonstrated how important advanced market commitments are for providing incentives to pull through vaccines. And I think, you know, in this, we're very much learning on the experience and success that we've achieved previously through AMCs.
Great. And I just had a question for you, Amanda, which was about are there any other measures that you think are needed to ensure equitable access to a vaccine?
So the answer that Gabby has put forward in its new strategic framework is increased investment in health system strengthening. And we have to look hard at what that means going forward. You know, in the past, these grants have been small in size. They've mostly gone to other partners of the alliance like UNICEF and the World Health Organization. So what is it that we'll be doing differently? I think the ICI note sets it out clearly. What are we doing differently that will actually deliver these changes and effective coverage in these underserved communities? So it's not an easy answer right now, but we'll have to watch that space.
Great, thank you. And for the final question, if I could turn to Navendu Mishra.
Thank you, Chair. So this question is more about the role of the Chief Scientific Advisor in the internal review of UK aid. So for the first part of the question, if I could turn to Professor Watts, if that's okay. In the absence of global health strategy, how can the government's performance against global health objectives be measured?
I mean, in terms of the commitments in global health, there are a range of areas on results that the government is committing to. And that fundamentally, I think, is the ways that we should be measuring impact. More broadly, in responding to outbreaks, in thinking about global health security, science has a critical role to play, and that is both helping to understand and assess what those risks might be, but also to identify and invest in effective solutions. And if you look at, for example, our response to COVID, we've been very heavily investing not only in the technologies, but also in bringing science advice to the current response, commissioning a range of analysis, both social science input and also modelling analysis as well, to support our country offices assess what the situation looks like in the ground, have access to projections of what might be the trajectories, and then to base their decisions to form their decisions based on that.
Thank you. For the second part, I'll keep it, if you could keep it brief, please. Just turning to Dr. Barton and Amanda Glassman. Do you agree with that? And how should the government's performance on global health be assessed?
Well, to be super brief, I would say yes, we need an overarching global health strategy. As you've already heard from us, we think that that's enormously important. We obviously, as I believe the evidence is the basis on which allocation and policy decisions should be made. So the role of the chief scientific advisor and the professional cadres should be very important in making these decisions. We do think that these strategies have to be published and the government should be held accountable for them. We did observe that the results that DFID is claiming, we had some quibbles about whether they were over-claiming in relation to what can be attributed to them. And ICI will continue to scrutinise carefully whether DFID is living up or indeed UKAID is living up to those commitments.
Thank you, Dr. Barton. Amanda, do you have anything to add? Or?
Yeah, I think I would agree with what Dr. Barton's just said. I would also say that the big investments that UKAID makes in global health are well known and have very clear objectives. And so the next step is saying, how well are we doing against those objectives? How do we know? I'd like to see less modeling studies and more empirically observed impact on the ground. And so if we took the case of Gabby, we'd like to see that vaccination coverage would be at least sustained during this period, at least in those very large low-income countries, low-middle-income countries that will matter for global spread of disease, and that excess deaths are minimized. So those are the kinds of things that one might look at in a second phase.
Accountability is very important. So thank you so much, Chair. Thank you.
Thank you very much. I'm conscious we've run slightly over time. So if I could thank all of our witnesses for coming today to give evidence, and to all of my colleagues. I'd now like to call this meeting to an end. Order, order.